What drew me most really to orthopedics was injury. People get injured. I personally got injured. I hurt my elbow. Went to an orthopedic office, and I thought that that was pretty awesome. That there was a job out there really that you could help people, specifically sports people, get back to playing sports and really get back to enjoying what they want to do. So that was the true driver of that.
I've been through a lot of surgeries in my life. I've had 23 surgeries on various things, and I sort of have a routine where I want to have a little mixture of humor and a good relationship. I get that here, and that's an open, honest relationship with your doctor. I'm not holding anything back with him, and he's straight shooter with me.
I myself enjoy living an active lifestyle, and I think having that understanding with patients is important once you see them go through an injury, through the rehabilitative process, and then of course return to activity. The physician assistant is a mid-level provider that helps provide care at all different levels through the patient experience.
I feel at Integrated Orthopedics we're able to bring in a complete patient experience. There's no sort of fragmentation of the care. You have surgery done here, you have conservative treatment done here, and you go over to physical therapy. I know exactly what's going on.
Everybody in our clinic is a big believer in manual therapy, and it's extremely important that you do have that manual therapy and that the clinician is constantly reassessing you and progressing you. It's so neat to have a patient come in and see how low functioning they are and how limited they are and bringing them back to full function.
The PT process was great because every time I had some acceleration, every time I had some issues, I felt that information was being transferred sort of on a weekly basis to Dr. Gruber.
Some of the different approaches that we use at Integrated Orthopedics really is the continuity of care. We're very active with biologic medicine. We want to make sure that all patients understand that they have options, why we're doing it, and if they were not successful, then what are the next steps? Typically, I talk about kind of the rung of the ladder, and surgery is always the last rung.
There is nothing that happens that they don't move forward unless you absolutely understand the process and why we're doing it. It's not just we're going to do this and then we do it. It's we're going to do this and this is why and this is what you can expect.
My arm, I can raise it higher, whereas before I couldn't get it above my chest.
There's nothing like a doctor that knows what he's talking about, goes in, does the job, and you eventually come out with what he said you were going to come out with.
One of the other unique things that we do at Integrated Orthopedics is we're tracking our outcomes, which is valuable. I can compare, how we're doing our rotator cuffs or our ACLs to the rest of the country. The real art of practicing as well as doctoring is taking great care of people when things aren't going exactly as planned, because that's really when they need you most. I think that's when it's most important for us to really help our patients through it, guide them through the process, and we will get them there. The most rewarding thing really is getting patients back to doing what they want to do, and that's pretty plain and simple, because that's why they're here.